Hey guys, Chemo Casey from Jacked Over 60. Welcome to a new video. Stats for the day, almost the same, but with a twist, and I think it's slide number 3. 60 years old, 5'11", 179 pounds, still at 16% body fat. Never been jacked, trying to get jacked. Getting a little bit better every day, but I haven't had that breakthrough burst of like steroid size that they keep telling me is coming. So we're just going to keep working hard. I just started Cialis. And the combination that these guys got me, and I'll talk about it on a full slide, is tadalafil, which is the active ingredient in Cialis for ED, but also a thing called atorvastatin, I think that's how you pronounce it, 11 milligrams, and that is to reduce cholesterol and the risk of stroke and heart attack. And I'll tell you how I got this combination online without seeing a doctor. And speaking of not seeing a doctor, I'm still not a doctor. Okay, now, if you guys watched the last video, I told you I'd always give you total honesty and complete transparency. Man, did I fuck this up, and I failed miserably. I had the theory, and not just my own, but based on some medical journals and some advice, that the more protein that you could process, the quicker you could gain lean muscle mass. However, you have to actually be able to process that amount. So in the last couple of days, I had doubled my protein intake from about 150 to 175 up to 320. I was bloated as fuck, sick, tired, lazy, horrible. Could not get rid of the bloating. Felt like I never actually processed any meal. In fact, I think I ate a little bit less solid food because I just couldn't process it all. So the experiment failed. I'm back to 150, 175 milligrams per day. So if that's why you guys have me on the channel, I'm the human guinea pig taking the arrows, just like all the pioneers got, okay? So boys, stick with the regular recommended amounts of protein. You'll thank me later. Few words these days spark as much controversy as the word testosterone does. A lot of people think testosterone replacement therapy because that's so common and in the news all the time, and it seems like everybody and their brother is on that. Or is it just plain out testosterone as in steroid abuse and use? Well, testosterone is the backbone of the male anatomy as far as chemical wise. It's what gives us our strength. We have 12 times more testosterone than women have, and along with the fact that we have different makeup of muscle fibers and body composition, it's one of the main reasons that men are quite a bit stronger than women. Now, testosterone has what they call a 1-to-1 ratio, meaning 100 anabolic and 100 androgenic. So that means for every muscle building of male hormone, the equal and opposite female, meaning it produces into estrogen down the line. Now that's an important factor as we talk about different steroids going forward, because that testosterone is always referred to as the baseline. The main chemical, they'll say, let's build a cycle on top of test. There's always test, and then they build it with other things. I personally, people ask me, I take 70 milligrams per day, 420 milligrams per week. Now, where does that fall in the range? Well, I'll tell you. Your normal TRT dose for a man of my age who had the scores that I had of 310 nanoliters per deciliters of free testosterone, the dosage would be between 140 and 250. The dosage I was actually given was 250, and 250 did work quite well. However, I'm your human guinea pig and experiment, and I'm going to try to put on more size, quicker, with harder exercise and a little bit more testosterone as a base. And you'll know why I'm saying base when we get to the next slide. Next, please. Anavar is an oral steroid known as oxandrolone. I think it's fucking amazing. I take 20 milligrams per day or 140 milligrams per week, and it has the ability to promote muscle growth. It increases the protein synthesis in the muscles, but it doesn't add extra water weight. It doesn't give you insane mood changes, and for the most part, it is processed more in the kidneys than it is in the liver. So it is very, not safe, but less toxic than any other oral steroid out there, and I think it is absolutely magical. I can notice a humongous difference when I take it, and I grind it up and chew it up. I leave it on my tongue as long as possible. I let it lingually go 30 minutes before I go to the gym. By the time I get to the gym, you can actually feel it kick in. It has the ability to create a great mind-to-muscle connection, and it also does a fantastic job with vascularity on the arms. It's just, I don't know what the vascularity that it brings out and kind of the striations. I don't have a suntan or anything, and I haven't been going, outside anything except trying to do my basic exercises. and follow the program and document it for you guys. So I think there's massive potential here. So when you take 20 milligrams a day, okay, chemo, where does that fit in the realm of, from standard to bodybuilding? That is a normal dosage that someone would be prescribed. Let's say they had some sort of muscle wasting disease, or maybe they lost some flesh in a fire or an accident, and they wanted to rebuild it. That is the normal dose. Bodybuilder dose, I've seen guys up to 80 to 100 milligrams per day. I can't imagine how well that stuff works. So I'm just telling you, I'm a big fan. Well, human growth hormone. Controversial, yes, but been tested for a very, very long time and proven to be safe at lower doses. I have so far stayed in the very, very low doses within medical recommended guidelines, and that is 0.5 U's or international units, which converts to milliliters on the little syringe, as you can see that. And I basically, they say it, gives you the ability to exercise more. Haven't noticed that really. Maybe I don't take that much. To recover quicker, maybe. That's really what I take it for. I don't know 100% if it's working at the dosage that I'm taking, and it's supposed to help lower your body fat, and I certainly have not seen that come up. I'm still fighting this visceral fat thing right here. As you guys see, it's 16%. Not happy with that. I'm going to bust out the shirt at 14%, but frustrating as can be because it's very difficult to lose. But anyways, that's what I'm taking for the human growth hormone. Do I think it's worth it? Yeah. Is it expensive? Yes, but tried and true, and seems pretty safe in most of the literature that I've been able to find, even at some really high-end medical places such as Harvard and the New England Journal of Medicine. So I wanted to share this with you guys because I find it fascinating and very interesting, and when you actually think about it on a logical level, it makes a lot of sense, right? Cialis and Viagra, they open up your blood vessels to give you more blood flow to make your dick hard, right? So why then, if these things are treating you systemically, meaning you take it in and it affects all the cells in your body, but it particularly helps the ones that need the help, why wouldn't it help the rest of them? So I did some research on this, and they have shown that actually Cialis can help you build muscles. It actually does like a nitrous oxide booster. It opens up your veins, transports more red blood around easier on your heart. And when I went to check out the Cialis and get it online, I got it online, didn't have to see a doctor. You fill out the forms and tell them what's going on, and they send you the stuff. This place was cool enough, and I'm not sure how this goes, so I'm not going to give them a plug or even show it. But I told them what I was taking. I said, look, I'm taking some HGH, taking some Anavar, taking some testosterone, a little bit over the recommended TRT dosage. Well, when I got the Tadalafil or Cialis, it has a secondary drug in it called atorvastatin. Again, I think I pronounced that right. And in 11 milligrams of that. And it's basically a cholesterol lowering and reducing the chance of stroke drug. And I did, again, all my research to try to be, as educated as I can and pass on the facts to you guys. And sure enough, this is one of the things that doctors will prescribe for some bodybuilders who are on super physiological doses of steroids, which would be about 3 times the doses that I'm taking. So I thought this is a great head start to keep my cholesterol under control and make sure that when I monitor my blood work in 2 weeks, I'll have been on this for 3 weeks. And let's see how it affects my cholesterol ratings, and I'll certainly share the whole blood panel with you. Maybe I can figure out how to link the two into the bio or something so you can see the two side by side. Anyways, but I'll show you a picture of them on there. All right, guys, with that, go out and make it a great fucking day. All right, I'm still kind of tired and bloated from that protein fiasco. So, hey, if you like what you see, please subscribe, hit that like button, and shoot me a comment. I try to read all of them I can. Thanks, guys. Have a great fucking night.